Hi, this is Sozan.
Hi, Hasan. How are you doing?
Is my
So
voice
we are live now. We are just waiting for the attendees to join.
participants okay?
Yeah. I see that there is a number of them. So good afternoon, everybody. I'm Jorge Gonzalez. I'm the director of Tbmed. We are a digital health association that promotes digital transformation across Europe and the world. Here today we have İlkay from the Ministry of Health of Turkey that as I was saying in the social media, I was really amazed some years ago when I, due to an European project, I get to know the technology that the ministry has developed for um, for managing the information systems, and especially the patient portal that they have, the app. I was amazed 4 years ago, so I'm really wondering to see what the Ministry of Health has been doing during this time to improve the system. So without further delay, I would like to invite İlkay to start his presentation. We will be there will be a 20 minutes approx presentation, and after that there will be the question and answers. The idea is that you guys use the Q&A functionality of Zoom that is at the bottom of the page, and then you can also follow the chat with indications from us, from the organizers. But we like to start sharp in time, and also we like to finish on time, so you can always rely on our timing to do your other tasks. So please, İlkay, introduce yourself, and thank you very much again for sharing your insights with us on the ecosystem.
Thank you, Jorge. Hello, everyone. It's very nice to
We
be.
cannot see you, İlkay. I don't know why.
Sorry.
Yeah.
Thank you, Jorge. It's nice to be here. Being a part of such an exquisite event is very pleasing for me and also for Turkish Ministry of Health. And today I'll try to show you our brand new, I would say brand new, but it's not that new anymore. It's 5-year-old technology, 5-year-old baby, e-Nabız. Let's start here. Digitalization takes time. You cannot digitalize your organization in overnight. So our digitalization journey started 10 years ago in 2011. A bright guy came with a question, a what-if question. What if we develop something like Facebook, but for healthcare, through which people can see their data, can share their data, and can do whatever they want with their data? Can we do that? The question was simple, but the solution, the development of the solution took merely 5 years, 4 or 5 years. And then now we have this e-Nabız solution. What can you do with e-Nabız? You can see your hospital visits, you can make appointments, you can see your prescriptions, you can share your data, you can make organ donation statements, you can see your disease details, reports, images, emergency notes, you can see your baby's injection calendar, you can input allergy details, you can set medicine reminders, you can make blood and bone marrow donation, and so forth. The basic qualities are citizens can access their data and can manage their data. And in the other side of the coin, physicians can access their patients' health data depending on the level of consent of the patient. And it is the one single platform for personal health data. What are the other features? We can say that the solution is totally integrated with e-government solution. And citizens can change their family medicine, which was a bit difficult before 2015. And citizens can access their children's injection calendar. Being a father or mother is something difficult, so we want to make it a bit easier through the solution. This is the main dashboard. You can see everything clearly in the right, left, or center sections. In the left section, you can see the visits, prescriptions, reports, diseases, tests, images, and all the tabs, and you can explore. And on the right side, you can see your previous hospital visits, and you can see the closest hospital to your location. In the middle, you can see the data coming from your wearable devices, if you have any. And also you can see your basic information right here. And I think this is the most important part of the solution, the sharing part. As you can see here, we are authorizing the patient about their own data. You can share their data with any physician in the ministry, and you can share their data with every physician they get their treatments. You can share their data with the physician who performed the ongoing examination, or you can share the data with your family physician, or you can share that no one can see your data. This is very important, and you can change this setting whenever you want. And this is my hospital visit section. You can see your hospital visits here. You can see the details. You can share this event, or you can evaluate. If you had a bad experience in the hospital, you can evaluate, and we will see through our decision support system integration. We will see every single feedback coming from the patients. And this is the prescription section. You can see your prescriptions right here, and also, and this is the prescription detail screen. You can see the details of your prescriptions, and if you want, you can, and if any, you can add side effects for this specific medicine. And this is the reports section. You can see your reports here. You can see your diseases here. And as you may see, the data goes back to 2015. You can see your tests in this section, and if 99% this is correct, but if 1% the data is not correct, if the data is not correct, you can report this error by using this button. This action does not belong to me, and we will correct the situation as soon as possible. You can see your images right here, thanks to our integration with the teleradiology platform. And you can add any allergies if you have any. You can add emergency notes. For example, you're unconscious and you're in the ambulance as a patient, and no one can ask you any question. No cooperation is possible. The healthcare staff can see your emergency notes. For example, I have diabetes and I'm using blah, blah, blah injection. So be informed. And healthcare staff will provide treatment accordingly. You can see the vaccination calendar of your babies, of your children. You can see the medications of your treatment. This is the important section. You can share any or some of your health records with this section, and this sharing can be permanent or temporary. You will be the decider of this issue. You can share any or all of them at once, depending on your choice. And you can make hospital appointments in this section thanks to the integration with centralized doctor appointment system. You can make your appointments and you can follow it on the calendar. If you wanna be a blood donor and if you wanna donate your blood, you can use this section, and the related teams will come in contact with you. And I think that is the one of the most important parts. You can donate your organs through this section. Organ donation is something serious and bureaucratic issue. So by ensuring the people make their donation safely and rapidly, we open this section, or we open this tab. You can donate your organs here, and the related teams will communicate you as soon as possible in this respect. You can set medicine reminders for you. For example, if you're an old person, if you have problems with your memory issues, you can set your medication reminder and be alerted when the time is come. You can change your family physician in this section. This was something a bit difficult before 2015. You were going to your new family physician and giving a report, a document that you want to be his or her patient, and if he or she approves that you can change your family physician. This was a bit bureaucratic, so we solved this issue with only 2 clicks. You can change your family physician, and you can see on the map the available family medicines, and you can see their current status. If it's red, that means these family medicine has too many patients and more than the threshold or within the threshold. So you must choose yellow or green ones. e-Nabız also has a mobile application with same features like the web platform. You can see any of your data again. You can see your images, and you can see and share your wearable device data. All the wearable devices in Turkey have to be compatible with e-Nabız in order to be certificated. So any wearable device works perfectly with e-Nabız. You can input your data through your wearable device. And these are the stats. What the most important part here is the user count. Turkey has a population of 83 million. Let's say every 1 person out of 2 is using e-Nabız actively. This is a huge success for such a solution, for a 5-year-old solution. So reaching these numbers is very promising, and also makes us work more in order to reach more and more people through the solution. 15 million physicians, 15 million access was realized by physicians, and close to 9 million organs are donated through e-Nabız. This is the number of the statements provided, not the actual organ transplantation, but 9 million organs are already donated on e-Nabız, which is also very important for us. We worked hard, and then we are awarded naturally. In 2016, World Summit Awards, which is an United Nations initiative, it chose e-Nabız as the best health app in 2015, and this was the first in Turkey. Also, some national awards are given to us. The ETR Project Awards of TÜSİAD, which is an important association of Turkish industry, and Turkish Informatics Foundation chose e-Nabız as the best government app for citizens in 2015 and the best developing project in 2016. And also, International Data Corporation chose e-Nabız as the best change management project in 2017, and which was very important for us. I finished I tried to cover everything that I can, and also there is a demo account in e-Nabız website. You can choose the English section and use the related tab for your example for sample account, and you can use and see and feel as a patient. And finally, I want to say that Turkish Ministry of Health does not like to be good. Our vision is perfection. Perfection is what we are after. Thank you.
Okay, that was very. I'm amazed. I'm amazed. There is a number of. There is already one question, Ilkay. I ask everybody to use the question and answer feature of Zoom that you can find if you mouse down. I mean, you mouse over the bottom page, bottom part of the page. Carlos is asking, Ilkay. You were mentioning patient data. Are you guys performing value-based healthcare? Can e-Nabız make it possible? That's the question from.
Thank you, Carlos, which is an exquisite question. Value-based healthcare is something that we want to achieve through e-Nabız and also through our other technologies, like our decision support system, which is SINA, which has AI as a feature. So value-based care is our aim. I cannot say that we are making it 100%, but we are on the way of doing it 100%. Thank you.
Right. Thank you very much. There's another question. Did you manage? How did you manage change management with difficult stakeholders? This is a good one. Thank you, Ami.
Thank you, Ami. This is also another question, another nice question. Change management is something difficult in every location because resistance to change will occur in everywhere, in all around the world. So we applied some change management practices like PROSCI ADKAR methodology. We try to use it, but resistance to change is linked with healthcare or technology literacy. So if you can solve the literacy problem, you can partly solve the problem of change management, and also through valuable promotions, through correct promotion actions, you can solve this problem. But it took nearly 2 or 3 years for us to solve the change management problem. Thank you.
Right. I'm asking, could you please add in the chat, Ilkay, the name of the methodology, because I didn't get it. Can you please share it in the chat? Make sure that you send it to all panelists and participants, but because by default it's only panelists. What's the name of this methodology? Meanwhile, I have a number of ADKAR. Okay, I've never heard about that. I will have a What is Prosty? Those are the both.
Prosty is the name of the company, as far as
okay.
I'm not wrong.
Okay, I will research that. I maybe even ask you for references. I have a number of questions after this.
Please.
Say, maybe this is in the future plans, but I wonder, what about informed consent? Are you going to collect informed consent through e-Nabız in the future?
As far as I know, we are already taking informed consents through e-Nabız.
Okay, maybe it was my mistake. I didn't see.
Yeah.
So you have already consent. What about chat and telemedicine capabilities? Can you have video calls between doctor and patient and virtual visits, so to say, or any ways of communication?
Yeah, this issue has just started in 2020, thanks to COVID, let's say. We developed another solution, which is Dr. e-Nabız. Through this platform, patients and physicians can make an appointment. So a virtual communication is provided through this solution. And I can say that the teleradiology platform is very comprehensive in Turkey. Turkish Ministry of Health, as far as I'm not wrong, has the largest teleradiology archive in all around the world. So we enabled patients to share their images through e-Nabız thanks to the integration with teleradiology platform. And also radiologists can evaluate the reports from whenever they want and wherever they want, independent from their location. So we thought everything clearly and sharply when developing such a solution. As far as, like I said in the beginning, everything became a what if question, but making and realizing it took nearly 4 years. So we thought every step thoroughly and clearly. Thank you.
Fantastic. Well, I have to say, I'm amazed, completely blow my mind that you can put ratings on the patient experience. I mean, guys, you are so brave. How did you do that? I mean, they didn't kill you after when you propose it. This is coming to Amy's question as well. I mean, wow. Please expand this issue.
Of course. Think that you are a patient. Everything is fantastic in the hospital. Everyone is well informed. The doctors are skilled. Everything is good. But you came into the hospital and no one show interest into you. No one is talking to you. Yes, the treatment quality is fantastic, but how about the communication quality? So treatment, for us, treatment starts from entering into hospital and ends leaving the hospital. So we think this process as a whole and treatment quality, of course, it's important, but patient experience that matters. Because
I mean, you don't need to convince me, but what did you do with the doctors to agree on having that? I mean, how you didn't get a revolution or something from doctors saying no, patient rating me? I mean, did you have a lot of problems when you introduced the concept, or
this is important for physicians too, because they can develop themselves and be aware that if I do something wrong, I can get a negative point, which can be bad for my occupation, for my job. So
right.
I must be excellent. I must provide excellent service to make my patient happy.
So you didn't have complaints when you introduced this system? You didn't have complaints from doctors saying, no, I don't want this. You didn't have. Go ahead.
Okay, sorry. Complaints always occur. You cannot change the people's minds sometimes, but if you inform them accordingly and accurately and show the necessity of the solution and show the quality and also the product of the solution, they agree with us. They are convinced. So informing them right, informing them accurately, and showing the potential to them. These matter. These matter.
I have a number of questions from Amy. I'm going to read them one after one. First one is, how much savings have you realized with this implementation? How much did it cost to build the system? Not cheap, I think, but
I can provide you. I cannot provide you numbers, but I can make you imagine the cost. Think that you're a patient and you will be a CT examination, a computerized tomography, and you're going to the hospital. They make the examination. They give you the paper report and they give you a CD including your image. These reports and CD cost, let's say, 1 Turkish lira to Turkish Ministry of Health. And let's say in 2015, only for CT, more than 50 million CT examinations are realized, which is 50 million Turkish lira. 50 million Turkish lira is equal to $4 million, $4 million American dollars. And also, which is close to the R&D cost of the solution. Just one examination, and changing the system to e-Nabız and making it make everything on screen, make everything digital, gave you the R&D cost of the solution.
And about okay, so this is cost saving and the cost. You have already hinted about the cost.
Yeah.
Next question is sorry.
No, yes.
Right. Next question is about do you have virtual care platform set up on e-Nabız?
If I'm not wrong, I already mentioned it through Dr. e-Nabız platform, which can provide virtual care. But in the future, we will try to make it more common.
Right. How do you maintain healthy competition among different providers, such as virtual care providers? That's the last question for me.
The e-Nabız platform is mainly working with public health institutions, and also for private institutions we have agreements for data sending, data transmission. So such different providers does not need to be in competition for providing the best care. They are already in competition, but this is not about e-Nabız.
Right. Well, there is a congratulation note from Carlos. He says that your system is amazing, very powerful. So yes, congrats again for this. I have more questions from my own. What are your next steps in your roadmap? What is coming next? What are your plans for the next, say, 3 years? If you can disclose, obviously, whatever is not a secret. Whatever is not a secret.
These are classified information, I must say, but we are working on artificial intelligence. We want to engage AI into e-Nabız. Some parts are already engaged, but as a whole, we plan to engage AI into e-Nabız in 3 years or so.
Fantastic.
Thank you.
What about the prescription? I guess that you guys list the prescription list, okay? But have you thought, or are you providing any help in order to the filling? Say you are a patient and you need to organize your prescription, especially for these guys with they take several pills per day at different times of the day. Are you helping somehow? You know, sometimes they do these weekly organizers of pills, so they do it only once and then they take it just for lunch, for breakfast. So sometimes it can be very messy, especially for old people with a number of pills to be taken every step.
Yeah.
Are you supporting this step somehow with e-Nabız?
Yeah, Jorge. As I said, we have a medication reminder tab in the solution, which can be used for more than one medication depending on the usage issue. You can set your medication reminders for one or more medications, and depending on your frequency, you can make the related settings. Yeah.
Right. And regarding the data that you take from the wearables, which is again something that is amazing in my opinion. Do you support the patient with understanding the data? I mean, do you analyze the data and say, hey, maybe you should take, I mean, do you analyze the signal, so to say, so that you can put information messages or some kind of alarms or something back to the patient?
These healthcare promotion steps
Yes.
are something that we think for the treatment side. For example, if you're a diabetic patient and your physician says that you must walk 10,000 steps every day and use this wearable device, you can walk, or you don't have to walk, but your physician will see that if you walked or not. This section is designed for enabling the patient to share his or her data, and for physician to see these variable data in order to make the treatment more quality and more accurate. And for the data management issue, these types of data are not that much evaluated in decision support system, but how can I say, the encouraging messages, the message sharing with patient is something that we can add in the future or currently. Thank you.
I have another question.
Yeah.
If you had to do it again, what will have you done differently? So I always assume, I will put my question. I always assume people try their best. Okay. So yes. I imagine that you tried your best when you build it, but then you deploy it, and I guess you have learned a number of questions. What are these lessons learned? What would you have done differently from what you did?
If the mastermind of the project, if I were the mastermind of the project, I would do that project before its time, because PHR systems were something new as an idea. But I think 2011 was even a bit more, even a bit later. So we could be a bit faster. We made a pilot application in 2011 with 17 hospitals around Istanbul, the city of Istanbul. Mm-hmm. And the results of this pilot application gave us the thought that we must use it nationwide. So if I were the mastermind of the project, I would allocate more resources. We try to allocate as much as we can, but I would allocate more resources. I would be a bit more agile, and I would do the same as more or less.
Okay, I will make the same question but differently. What were the main problems, issues, bottlenecks, roadblocks while developing the project?
Yeah, thank you. The first issue, as I already mentioned, the resistance to change. This is the destiny of any solution developed for the public. Someone will resist and someone will follow them. So the resistance, dealing with the resistance to change was a bit tiring, a bit time-consuming. But through correct information channels, through giving valuable information to the users and to the physicians, to the healthcare staff, made us solve the problem in 2 or 3 years. Resistance to change was the primary.
So how did you overcome this? I mean, you have mentioned the ADKAR methodology for change.
ADKAR methodology, yes. We try to follow the basic principles, create awareness, create desire, provide knowledge, give them ability, and reinforce the using people. This was the methodology basically, and we tried to apply it step by step. Sometimes we had to go faster than normal. Sometimes we had to go slow down, but in the end, every 1 person out of 2 is using e-Nabız. This is a very important asset of the solution. This is very important for us.
And when you deployed the solution, once it was built, how was your approach to get it into every hospital? Did you identify? I mean, there are several ways, but what was the one that worked best? I mean, did you identify, for example, so to say, champions? You train these champions, and then it was up to them to introduce them in their departments, or did you follow another approach? How did you? Once the solution was more or less mature, how did you scale that to the whole country? Because not only to the pilot sites. How was the approach?
Yeah, I must say that apart from other European countries, Turkey has a central organization. That means there is only one Ministry of Health in the whole country. So we use this feature for designing our trainings for e-Nabız. We designed a comprehensive training program, including physicians, nurses, all types of healthcare workers who will be using the solution in the hospital. And also we organize some campaigns for the public in order to make them more aware about the solution and the situation. So these two-sided promotion activities provided insight to public and also the healthcare staff. And the solution was already mature and ready to use when we launched it. So we didn't experience any malfunction, any types of technical problems. Everything was ready and pre-thought when we launched the solution.
That's fantastic. More questions. Did you develop this alone as the ministry, or did you team up with external partners?
We teamed up some external partners, of course, because if we develop everything on our own, how can we feed the sector? So the sector must be also in the solution development in order to make them more aware, make them more engaged, and also some issues require a bit private insight. We are the ministry. Sometimes we cannot see the private partners can see. So as a second or third eye, they provided valuable insights for the solution.
Because can e-Nabız be purchased outside of Turkey? Can a healthcare organization somewhere else can purchase it? Is it on sale, or is only for private use for the ministry?
We are happy to collaborate with ministries, with private organizations if they want to purchase e-Nabız solution. We are open to that. Yes.
Fantastic. And then I think you mentioned, is there any kind of demo or something where demo space?
Yes.
Could you please share more data about how to access it?
Sure. If someone who does not have any e-Nabız account, if they want to use the system, we develop a demo account for them. You can visit enabız.gov.tr for.
Please put it in the chat if you don't mind, İlkay. Remember to send to all the panelists and participants. Okay.
Of course.
When you send it, because.
Of course.
No. This is. Please use the send to all panelists and participants. You are on this. Okay, now. Okay, well, I mean, Lola has resent. Okay,
yes.
so e-Nabız, so they go to that website.
Yes, just select the English section, the language section, and you will see some sections on the web main page. You
want to share the screen?
Of course,
please
of
do.
course.
Please do.
Of course, why not?
In Zoom.
There. I can share it. And you will see the English section here. It's already English. Example, e-Nabız account tab you will see on the right side of the web page, and you can use the same features as a Turkish citizen within the demo account. So everything can be clicked, can be seen. You can experience the solution on your own.
Right. Does it even with a wearable device? Does it also simulate that you have a wearable device?
Demo account is not open to
wearable, but the others are available. I mean, this is fantastic. I mean, guys, really congratulations. It's amazing. I mean, because what you mentioned about the artificial intelligence is that once you have all this data, then it's feasible to do artificial intelligence or enabling a lot of things once you have quality data, like the guys that you are acquiring with the system. So it's really it's building up. I mean, this is you need first the infrastructure, the data and information infrastructure, and then you can extract knowledge and valuable information once you have that. So this is really, really good. I don't know if there are more questions. I'm sorry if I'm monopolizing the conversation. It's a pity that the majority of the people that register is not attending. Hopefully they will see that once we record it. But I'm really, really amazed with what I'm seeing. I mean, if I will be ashamed to share the patient portal that we have in my region compared to you. I mean, it's such a far away from what you guys have. The idea about, I would like to ask the audience if they can put in the chat, what is the feature that it really blew your mind when you saw it? Can you, the people in the audience, just not to monopolize too much, or if you want to raise your hand, please say, raise your hand and we can say, for me, the idea about organ donation is fantastic. It's fantastic because I don't know how to do it. I don't know how to do it. And my wife and myself, we have talked about this, but I don't even know about the procedure, how to say that public. And just go to a website or something and say, click, click, click, I'm an organ donor. It's fantastic, man. It's great.
Thank you. Jorge, do you mind if I add something?
Sure, sure.
Because I forgot the COVID section.
Oh, please do. Please go. Please show.
During a COVID process, which is already ongoing, we enabled the patients can get their vaccination appointments through e-Nabız, and also they can see their results of the PCR tests through the e-Nabız account.
This is fantastic. Fantastic. I mean, once you have the infrastructure, then something happens and you have the possibility to react so quickly, so powerfully. This is great. I mean, I don't know if for the rest of the guys here, says Alain, the ability to choose with whom you share your info on permanent or temporary basis is great for patient experience. Yeah. I agree. It's also very good for GDPR, as in Europe, to enable your data to be used for research without going through complicated. I will add. Ilkay, I don't know if you want to add something about this comment from Alain. It's in the chat. This comment is in the chat. But this is for all panelists. No, Alain, please, I will do it for. I will put it for all the. Yeah, thank you.
Yeah, I already saw it. Thank you to Alain. I was smiling to what Carlos wrote. I downloaded manuals. This is very good because we are providing any type of data and any type of information for the people if they want to learn more about e-Nabız. And also I want to add that integration and interoperability are key elements for creating such a solution. Yes, infrastructure is important, but you can develop solutions. But if you cannot communicate your solutions between them, you cannot create such a level of value. So integration is one of our primary power, I can say.
Okay, so any other comments? Amy is saying that integration of wearables is brilliant. That's where the world is heading towards non-hospital-based care. So this is what really like it, Amy.
Yeah.
And yes, I mean, this is great. This is fantastic. Really, I think that you guys something very valuable here, and hopefully other healthcare organizations can take note and yeah. If I may, steal your ideas, okay? Because you are not competing with them. We are basically, everybody's taking care of their own people. So, but you are definitely leading the pack here with this amazing solution. So unless that there are any last minute question, I will close it here. But before, I want to thank Ilkay and also the people that from the Ministry of Health that we know each other because we have been collaborating in some European projects, some pre-procurement projects where we purchase innovation for technology. The collaboration has been great, at least from our side. We keep on, hopefully we will keep on collaborating in the future. But really, congratulations, guys, for the solution you have developed. And thank you very much. We finish here. I think that no more questions. We will put the recording on the website. We will share also the presentation from Ilkay, but really, more than the presentation, you can access this demo system that Ilkay has shown to play yourself with it. And just to say that the next iteration that we are going to have will be again next Thursday. We have a consultant from the States that is going to talk about digital transformation and some insights. You can see here, and you can register already in the link that Lola has just put into the chat. And thank you very much. As you know, every Thursday at 4, we will maybe change it to 5 Central European time. We have this kind of webinars where we try to show the top-notch solutions or ideas or insights for regarding digital transformation across the world. And definitely this has been one very insightful session to where technology, how digital technology can enable and support a lot of different things. So thank you very much again, Ilkay, Ozan, all the colleagues. I'm looking forward to seeing you next Thursday. Okay.
Thank you, Jorge. It's nice to be a part of such an exquisite event. And I want to finalize my words by saying that we are open for any type of collaborations regarding regarding e-Nabız. So I shared my email with the participants in the presentation. Sure. So we will be happy to help and share our experience. Thank you, Jorge. Thank you, everyone. It was a very nice event. Thank you.
Fantastic. Thanks to all. Bye.
Bye.